Great, welcome. Could everyone please stand for the Pledge of Allegiance? Pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, and welcome to the October 2024 Board of Health public meeting. So first, I'll introduce the Board of Health members. So I am Dr. Drew Bunker. To my left is Kathleen Savage, board member, and to my right is Viviana Catano, board member. Also here we have Lauren Buck, Director of Public Health, Michael Wells, who's Health Agent and Director of Inspectional Services, Paula Sepulveda, who's Board of Health Clerk, and Luis Cavagnaro, Building Commissioner. First topic is going to be reviewing and approving the minutes from the September meeting. So I just ask the other Board of Health members to approve those minutes.
I approve of the minutes.
I approve of the minutes also.
Great, me as well. Excellent. Next is going to be the Public Health Communicable Monthly Report with Lauren.
Thanks, Dr. Bunker. For October 2024, our communicable disease burden is relatively low again. It was low in September. This is consistent with what we're seeing across the state as well. I will just point out that we've had 11 suspect and 1 confirmed hepatitis B case. Our hepatitis B caseload is continuing to be trending high, and it's just a reminder that we are, it's important to make sure we're continuing and finishing our hepatitis B vaccine series. And I also will note that our COVID illness, we had 40 confirmed cases and 9 probable cases, low comparatively to other months, but we will continue watching both COVID and flu over these next several months. Some other public health updates from the North Suffolk epidemiologist who gave a report this week from October 23rd. Just 2 things that I wanted to point out. She mentioned avian flu. I've talked about that here in the past couple months as well. Continues to be a major concern throughout the country. Avian flu is suspected in 4 Washington state farm worker illnesses, and it has been traced back to some cows, killing some cows in California. And the Massachusetts Department of Agricultural Resources just want to make sure that in Massachusetts, we're advising that all backyard and commercial poultry owners to practice strong biosecurity measures to prevent domestic poultry from having contact with wild birds, their feathers, and droppings. The avian flu virus is continuing to circulate in the wild bird population, particularly in wild waterfowl. Eliminating standing water and preventing domestic birds from having access to ponds, streams, and wetland areas that attract wild waterfowl is of critical importance. Letting your flock free range poses substantial risk to exposure to HPAI, which is the acronym for the avian flu that is circulating currently, and those consequences can be deadly. I'm just pointing this out because Revere has urban farming regulations specifically around chicken keeping, and so I'm just putting this out for all the chicken keepers in Revere. That is very important to make sure you're taking precautions right now with this very, very infectious avian flu that's going around. And then lastly, I just wanted to point out the epidemiologist follows trends that are happening across the country and also regularly communicates with other epidemiologists in the state and the country. There has been a substantial increase in contaminated food products and recalls from major food production companies happening this month. Around 200 schools were affected by a recall of ready-to-eat meat and poultry products from the manufacturer Bruce Pack. This recall also affected stores at like Albertsons, Safeway, Shaw's, Star Market, and other grocery chains. None of the recalled products were purchased or distributed by the USDA's National School Lunch or Breakfast Program. All were purchased by private vendors, and so far no schools in Massachusetts have been affected, but there are some grocery stores in Massachusetts that have stocked the recalled products. So that was one example that's recently happened this month. Also this month, the Pennsylvania-based company has issued a recall on trail bologna meat processing kits that may have had an undeclared wheat or soy allergen. Also this month, Treehouse Foods which is a major food processing company, expanded the recall of frozen waffle products to include hundreds of breakfast foods found in the freezer section because of listeria risks. The brands include Best Choice and Crustez. I think that's how you say that. And then lastly, another thing this month, one confirmed death and other illnesses have been linked to a multi-state E. coli outbreak tied to quarter pounders sold at McDonald's stores. The CDC, FDA, USDA, and public health officials are currently investigating to determine which ingredient is causing the outbreak. And currently the reports are traced back to stores in Colorado and Nebraska. All of the things that I just talked about come on the heels of a major listeria outbreak associated with Boar's Head food products that started back in July 2024. It has now been associated with 10 deaths and 59 hospitalizations across 19 states. There are 3 new wrongful death cases filed this month associated with the outbreak, and the Boar's Head processing plant in Virginia has been permanently shut down. All this to say, recommendations from the CDC and the Public Health Department for Revere consumers is to regularly check recall lists on places like recalls.gov, sign up for recall notifications, examine food products for best buy dates, and if you're unsure about a product, call the manufacturer or make sure you discard any recalled or expired food products. That's it. Thank you.
Great, thank you, Lauren. Next is going to be the Inspectional Services Monthly Report with Michael Wells.
Thanks, Dr. Bunker. Inspectional Services Report for the month of October on the Interior Housing Division. We performed 170 certificates of fitness, 37 re-inspections on certificate of fitness. Interior complaints are in process, a total of 13. 4 interior complaints were received, 1 interior re-inspection, 1 pool or spa inspection. On the Food Inspection Division, we performed 37 routine inspections, 17 re-inspections, 1 complaint inspection, 1 pre-opening inspection, 1 temporary food service inspection. On the Exterior Sanitation Division, we issued 51 violations for accumulation of litter, trash, and debris, 3 violations for carts out at improper times, 41 dumpster overflowing violations, 386 improper placement of garbage, trash, and bulky items, 2 violations for improper signage on public property, 13 violations for improper storage of garbage and trash, 7 for junk heaps, dumps, and automobile graveyards, 3 for multiple unregistered vehicles, and 3 for rodent harborage, 35 for unclean, unsanitary land or overgrowth. And that concludes the October report.
Thank you, Michael. Next is going to be the Notice of Violation Appeal. So this is for the 838 Winthrop Avenue residents. I'm going to have Lewis come up and speak about the violation. And Lewis is the building commissioner for the city of Revere.
Yes, my name is Louis Cavagnaro, the G silent, like Noki. I'm the building commissioner, and this property has been a problem for a while now, and we just wrote up another order to correct that the property owner had an illegal bedroom on the first floor, and he's appealing the order, saying that it was a coincidence that someone else in the property bought a new bed, and that just so happens that that was right after I sent out the letter, and he had someone moving on a mattress and the bed frame, and he's saying someone else in the property bought a new bed. I looked through the property, and I didn't see any new beds in the room. So we have a picture of the bed, the mattress being moved out and put on a car. We have a picture when I was there doing the inspection, there was a guy carrying out the bed frame. In the room, there was a nightstand, there was laundry, there's a closet. I have all the pictures. It's in the order. I don't know if you guys have it. And in the room, there's markings on the wall where you screwed the headboard to the wall. And that's basically the order right now, and he's appealing it. So I thought he was going to speak first, see what he has to say.
And just if you don't mind introducing yourself.
Sure. My name is Saeed, S-A-E-I-D. My last name is Hosseinzadeh. It's a bit hard to pronounce. H-O-S-E-I-N-Z-A-D-E, and I'm the owner of this property, 838 Winthrop Avenue. I've had this property for like 3 years. It's an investment property, so I have tenants there. And yes, so there was this, I received a letter from Louis, I think sometime in in August, saying that there are violations. So he wanted to do an inspection in 5 days. And we actually scheduled an inspection, I think, in 3 or 4 days. So we came in, and he basically inspected the whole property, and there is a room in the first floor, as he explained. So that room it does have I did not build a closet. The closet was there before me. This is something that happened. So my previous tenants is this is around 2 years ago. My previous tenants were using it as a bedroom, and I was not aware that it cannot be used as a bedroom. But then when there was an inspection for another reason, so I was let known by the city that this is not a bedroom, so people cannot use it as a bedroom. So I asked my basically tenants not to use it. I had some issues with my previous tenants. I eventually let them go. So this is 2 years ago. Again, I imagine the screws that are on the wall for the bed, so it's for back then. So my new tenants came in, and because I knew that this was an issue before, and that room looks like something that can be used as a bedroom because it has 2 big windows, so people would normally think that they can use it as a bedroom. So I specifically put it in their lease that is not a bedroom. So this house has 6 bedrooms. According to the plan, 3 on the second floor, 3 on the third floor. And I specifically told them that you're not supposed to use this as a bedroom. There should not be a bed in this room. And they've not been using it as a bedroom. So they have a young teenager who uses this basically room as his a game room. There's a TV there, there's a gaming console. And I've seen that he or maybe some other people keep their clothes in that room. And yes, there is a closet, there's clothes around. I've seen that. And yeah, as Louis said, he told, I never noticed that, but he told me that there's a nightstand. I think that's they use a night. I don't know why that nightstand is in there. But again, they don't use it as a bedroom. I specifically asked them not to use it as a bedroom. It's in their lease. About that bed moving out of my property, right before the inspection happening, I asked my tenants what is going on, and they told me that we just changed the bed. That's why that's a coincidence. So what I can tell you is, whenever the city wants to come in and inspect that room, they can. And a lot of times, because that room has a window to the street. My property is such that it's a little higher up on the hill, so you may not be able to actually see that room when you're on the street. But if you come up the stairs a little bit, you can actually see inside that room, right? So what I understand what the city is saying. I'm not saying that I don't understand it. But what I can tell you now is, again, I told you all the stories, plus what I can tell you is, whenever the city wants to come in and do another inspection, I can schedule the inspection at maximum 2 days, because it's not always the case that I'm available on that day. We can schedule it in maximum 2 days. And they can always come in, see that. And Louis has been in my property several times before regarding other issues. So he inspected my property several times. And so over the past year, when I basically resolved the issues previously, 2 years ago, he's been in my property, I think at least 3 times in the past year. And he's here. He can tell that if he saw any bed frame in that room, there was nothing in there. And he inspected that room as well as part of inspecting the whole building. So again, that's what I can tell you is, I've been very clear to my tenants that that's not a bedroom, number 1. I haven't seen a bed in that bedroom, number 2. Number 3, If the city does not believe me and they want to do inspections going forward, making sure that that's not a bedroom, I can guarantee that I can schedule any inspection in maximum 2 days. They can come in. And when I say 2 days, because, I mean, it's not always easy for me to schedule an inspection because I'll need to let my tenants know in advance. And their work schedule is like, it's not regular, so during the day, I cannot do that. And they have their kids in the house, so it's a bit hard. Someone needs to be there for me to get in with the inspector and do the inspection. That's not always the case. But what I can do is, I can actually let them see what is in that room from the, not from the street, but like, from the front yard, because I'm the owner, I can just enter with an inspector, and we can see what is in that room. Very easy.
Great. Yeah, so thank you. I just have some questions for Louis. And do you have more to say, Louis? Sorry.
Yes.
Okay.
You want to ask me a question first or no?
Well, yeah, just a question. So just to understand the reason, what is the reason behind not having a bed in this particular room? And I know that may be very obvious. I'm sorry.
So this house has no driveway, so it's what you call a pre-existing non-conforming house. He can't add any more bedrooms to that house legally. So he's not allowed to use it as a bedroom.
Okay. So it's just based on the fact that there's a limit when someone has this type of house to the bedrooms. Okay. Got it.
Mr. Saeed, he has a poor history. When he bought this house, the previous owner had a second unit there, and the previous owner removed that second unit, and then when he bought the house, he put it back in. And then we had to make him take it out. And then he started renting out rooms, multiple people per room. It's the window that he's talking about, I can never see through it. There's always blinds on it. And I can't be going there all the time and checking to see if he's using it as a bedroom. I don't trust him. And then I want him to remove the wall and make it one open space. That way the city doesn't have to keep going there multiple times. And if he's using it as a bedroom, and then I go there to do inspection, he just removes it before I get there. And then he says, I'm not using it as a bedroom. So if you just remove the wall and make one open space, then the problem's solved.
And just so at the current time, how many tenants are living at the building?
I don't know.
Okay, all right. We don't have okay.
I don't know if the council wants to speak.
Yeah, please.
I got a long-winded. So, my name is Joanne McKenna. I'm as a resident tonight, not as a counselor, okay? I live next door to Salid. For the last 3 years, a really quiet neighborhood in Beachmont has endured an illegal rooming house with large parties until 2 and 3 o'clock at night. Loud music, loud parties. There have been 16 police calls since he bought the house. There has been a warning from the Revere Fire Department for open fires, okay? And if you see the picture, I have a neighbor here that's 3 feet or 5 feet away from his house. If there is a fire, 5 houses, 6 houses are gonna go up in flames. One of his tenants sent me a photograph, he's gone now, but one of his tenants sent me a photograph of the fire alarms being removed because people smoke in the house. We are so close together, neighbors are afraid of fire. If there is a fire, 5 to 6 houses will burn. My house will be one of them. All I can say is that this was a really quiet neighborhood. When we met him, he said, I'm gonna move in, I'm gonna be the tenant, I'm gonna fix the house up, I'm gonna do this, I'm gonna do that. People come in all hours of the night with mattresses and refrigerators. When I called Louis, because I was the one that called Louis and said, what is going on next door? He went in with a bunch of inspectors and found people in bedrooms multiple people in bedrooms with a refrigerator, microwaves, and I think there were locks on the door. The locks were removed. Now, I'm not sure about that, so don't quote me, okay? And because I complained to the city, he's insinuating that I'm a racist, which he doesn't even know that my mother and brother were born in Italy, and I'm first-generation immigrant. So he's shown pictures to, he's videotaped me because I was trying to get 3 feet of my property, and I was on his property, so he had his tenants videotape me, and then he came into City Hall and showed people that look at what she's doing. Look at what she's doing. And he should be ashamed. He's a professor at Suffolk University, and he has this house that is an illegal house and is inundating the neighborhood. And let me tell you something. We have all senior citizens that have lived there for 40 years, 50 years, around his illegal rooming house. He's been fined, and he went to court, and they upheld it. So I don't know. I mean, my house faces the room that he's talking about, the big window that you can't see because there's a shade there. Okay? I know at least 15 people that are living in there. Some are related. There's family. There's, a son, a mother and father, but there are other people there. There was a young couple with the dog, and they had to get rid of the dog because they were put him in the back where he abuts my property, and the dog was crying. They left him there with no water, nothing. So I complained again. I'm a big complainer. I'm sorry, but I mean, if things aren't right, I'm working for the city to make things right. And I've lived there over 68 years. I've lived in that house and never had a problem. Now we're having a problem. And it's been 3 years we've having a problem. And he'll sit there and he'll say, oh, it's the tenants, and I have residents, I have their licenses, but what about the other people that have no licenses that come in and they're living there? Yes, he can show the proof of licenses that people are living there, but there are people that take the train every day that don't have cars. And I just want to say, there's no parking, and there's 6 cars there now. And if you live on Winthrop Ave and you don't have a driveway, it's very hard to park. Thank you.
Yeah. The tenant, and then Saeed, we can have you come up after.
You didn't hear that? I've been told my voice is deep anyways. When the gentleman here purchased the building next door to me, he told me that he was going to move in. I wished him the best of luck. After that, it became a bed and bath. I had people knocking at my door at 2 in the morning, waking me up looking for a place to sleep. Said next door. This went on for quite a while. Eventually, the bed and bath disappeared. But the people coming in and out at all hours of the night, you can hear the car, you can hear the people bringing mattresses in. My door is less than 5 feet from his door. And when they're carrying up big bookcases and stuff, and you can hear them speaking in their language.
Just giving your name, sorry, just.
Oh, my name?
Yeah, thank you.
I apologize.
No problem. That's my fault. I should have.
Kenneth Labbe, L-A-B-B-E.
Great, thank you.
And I get woken up, and I got to come out and see what's going on. And my wife will come out, and I'll say, oh, they're moving something in. Whatever they do next door, it's like sometimes they're in my parlor. I can hear them in my parlor. If they're playing their music, it's not like when my granddaughter plays her, she'll say, Alexa, play. I'll say, go to volume 3. Loud enough, she can hear it. When these people play their music, it's loud enough for Frank, the next house to me, can hear it. So it does get a little bit annoying. During their soccer game, I know everybody's big in sports. They set up a big TV outside, and there had to be at least 30 people out there. And I couldn't sleep because the soccer game going on. But I didn't complain about it. I just kept my mouth shut and rolled over and put the pillow over my head, try to muffle the sound. From day one, he hasn't been completely honest, all right, with the neighbors. I've tried working with him at times. We've tried doing things, you know, that if he needed something done, I'd say, okay, I'll take care of that, you know? Even though that wasn't my property, it was his. But it was my stuff on his property, so I would take care of it. The only thing I could say is I still see people coming in and out all hours of the night. And yes, to confirm what he just said, the inspectors, when they go to the house, they have to notify the party that they're coming. I would assume that's one of the laws. By doing so, you open the cage and let the roaches out, and you don't see them. What I mean by that is, if you inform somebody you're going to do an inspection on their house, I've seen people carrying box springs, mattresses, loading them up on cars. I looked at my wife and says, oh, people are moving. But they'd be back 2 days later. So your inspections mean nothing if you don't go there for a surprise inspection. Catch them while they're there. That's all I can say. Thank you, ladies and gentlemen.
Saeed, do you mind coming up and speaking? Yep.
Okay, so there is, that's, so they brought up several issues. So the way that I'd like to proceed, if you agree, is there is a specific there's a specific issue which is in the letter violation, and that's why I'm here. And that specific violation is the bathroom, is the illegal bedroom. If we want to talk about fire alarms, if you want to talk about my tenants being loud, if they want to talk about like some other stuff, I'm happy to do so. But at the same time, I want to use my time to make sure that this specific topic that you're going to talk about today is taken care of, and I will be listened to. Okay?
Yeah. So just to clarify, that's why we're here, is for the appeal for the bedroom. So I know they brought up other points. You don't have to have some sort of answer or response to those points, because I don't think are relevant to why we're here.
Exactly, and I'm happy to. Again, I can explain, and I'm happy to. But again, if there's a certain time, I don't want to spend on some other stuff, and we don't get to talk about this.
Yeah. So
Yes.
from my perspective, I can ask the other Board of Health members. I think we're trying to stay on topic for why we're here. I appreciate everyone who came and spoke, and I understand that that's why we have this open forum where people can speak and talk and tell what they're experiencing and what they've seen. But I think to stay on topic, I think for now, if it doesn't pertain to the appeal that you're talking about for the bedroom, I think rather you not talk about that. But again, this is an open forum.
Okay, sure. So regarding that, so first of all, I appreciate the feedback. That's not like I've tried, and I always told my tenants to try to be good neighbors. It's not always the case because houses are very close to each other. That's a separate issue. But so regarding that bedroom, that illegal bedroom, I think I've told you what I needed to tell you. Again, so for me, so first of all, so Louis said that we actually met like 2 months ago, and there was a remediation plan. And as he explained, he wanted me to basically remove one wall and basically extend the main entrance to that room to be a big space. So that incurs significant cost on my end. Plus, it reduces the value of the property significantly because the value of the property, the number of rooms, has an impact on the value of the property. So I do not want to do that because of the reasons that I told you. And if there is something that my tenants do illegally, let's say, I need to tell them that this is what you're doing illegally, that's the proof, you have to pay me and you need to leave, okay? So I cannot tell them that. So first of all, I don't believe that there has been a bed in that room. That's number one. But if there was, or if there is, or if there will be, okay, I need to show them something saying that I specifically told you, you signed a lease, no bed in this room. So I'm going to fine you and you have to leave. I cannot tell them that there are screws in the wall showing that sometime there was a bed here. I cannot tell them that there is a nightstand there. That's why this is a bedroom. I cannot tell them that why do you have clothes here? Why do you have laundry there? That's a room. They can do whatever they want to as long as they don't put a bed, as long as no one sleeps there, that's fine. Okay? That's my take at least. Like, you know, if you guys think differently, let me know. And about the inspection, right? Again, I told you that. If the city wants to do the inspection going forward, I'll try my best, as I said. I'll try my best to, I will we will schedule the inspection in not the same day, because I told you I cannot always do that, but in 2 days, at like maximum, 2 days. And about like this, I understand this concept of like, you know, surprise inspection, but it's not like, you know, I'm doing something and FBI is going to raid my house. Like this is like an illegal bedroom, and like the inspection I need my tenants know, I need to know. It's not like that's how it works. So you cannot just tell people that, oh, I suspect you're doing something, and I just, without any phone call, just show up, I just like, you know, enter your property or whatever. And because I think that if I call you in advance, you're going to, whatever, do something about it. It's, again, like, you know, you're talking about like an illegal bedroom. It's not like people are like doing something like crazy over there. That's not the case. So again, that's like all I can do for the city. Just to make sure that that room is not used as a bedroom.
What is your, oh, sorry, Mike, go ahead.
Just a point of clarification as well. Under the state sanitary code, property owner is required to give their tenants 24-hour notice of an inspection. So as much as we would love to do surprise inspections, you know, those happen in businesses, but on the residential side, unfortunately, that cannot happen. Yes, we're an enforcing agency as far as inspectional services goes, but we unfortunately don't get instant results, right? And I've talked about this before in different areas, but you know, we have policies and procedures that we need to follow. We can't trespass on a property. So there are rules and regulations that we need to follow as a department and as inspectors. So it's not as easy as it may seem to get things done. We eventually do get results, but it's not like police. You know, someone's breaking into your house, you call 911, police show up right away. Same thing with fire. You have a fire in your house, you call 911, they show up right away. They can trespass, they can break your door down, they can get into your property. We don't have that power. So it's important to understand that we have to send letter 1, we have to send letter 2, we have to send letter 3. We have to get in touch with a property owner before we can physically take action and serve property owners.
Thank you, yes, so.
I do have a question. Mr. Saeed, do you have a copy of this tenant agreement that proves that you asked them not to make this into a bedroom?
and again, it's something, I'm not sure if it's going to help or not, but I had potential tenants coming in and seeing my property, and they asked me, like specifically, I do have the communication with them. I can provide it later to you if it helps. So they specifically asked me if they want 7 bedrooms, otherwise they don't rent it. They don't rent it as a 6-bedroom because they needed 7 bedrooms basically. And I said no. So I told them specifically that I cannot, that's illegal. That room doesn't have it does have, what do you call it, not exit, whatever, egress. So it does have, it's got 2 large windows, but it does not have a smoke detector in that room. So I specifically told them, I told them my tenants first, my current tenants, and also the prospective tenants, I told them specifically, and they're they said, we don't rent it. And I was like, I don't care, you don't rent it, it's a 6-bedroom legally. And that room, it's dangerous for you. I cannot let anyone sleep in there. You cannot use it as a bedroom. And again, I've been clear about this in the lease with my tenants and with prospective tenants. We said that no one should sleep in this room. That's it.
Can I clarify something? So this is a 1-bedroom house, I'm sorry, this is a 1-family home, right?
Yes,
It just happens to have
3 floors.
oh, really? So a 1-family home, 3 floors,
3
3
floors.
bedrooms in the
And the
second floor. And so the number of tenants on this lease is 7, right?
Yes.
So there should never be more than 7 people at this property.
So there is 2, there is one, there is 2 those names, those are the kids.
So Sandra, Mario, Duven, Luis, Santiago, and Doris, plus the 2 kids. So there should never be more than 9 people in this house living there?
Yes.
Is there a reason why the kids are not mentioned in the lease?
I don't know, no.
Okay. And so you told your tenants that they're not allowed to rent out rooms separately?
Yes.
And so I see here that you put this property a single-family house, no rooms can be rented separately, no lock can be on any interior door, refrigerators, microwaves are not allowed in the bedrooms, and only refrigerators, microwaves are placed in the kitchen and are shared among the tenants are allowed. So I guess my question for Louis is, when you did the inspection, did you find microwaves and refrigerators in the other bedrooms? Like, were you able to inspect the other bedrooms?
Yes, I walked through the whole house.
And did
but
you
there was no microwaves or fridges in the bedrooms this time. There was years ago, but he since then had them removed.
Okay.
So let me, if I may, yes. So what happened was, there was actually, so the thing is that I have this letter from my tenant, sorry, it's in Spanish, but I had it translated in English, and I already sent it to the city. So this was, when, I think it was last year, so when Louis inspected the property, he found 2 small refrigerators in 2 of the bedrooms, right? So I did not know that, these small refrigerators are illegal. I think they're not, but that's why, and I did not know that those 2 rooms, they had these small refrigerators. But Louis told me that city thinks that makes it potentially whatever, city didn't want them. So I asked them to remove those. Plus, I also asked them to explain why they had those refrigerators. So in that letter, they say that they have a small kid. So the lady says that we had this small refrigerator because overnight we just wanted to give milk or whatever to the kid. So that's why we had that small refrigerator. Plus there was an older lady because the staircase to the kitchen down the stairs is pretty small. And the older lady said that I have this refrigerator because it's hard for me to go down the stairs to use the main refrigerator in the kitchen. However, I still had them remove those. And then, because again, like all those terms that you see that I added to the lease was because, I mean, initially these were not included in the lease because I did not even know that these were going to cause problems. But like knowing that these are problematic, so I specifically told them no refrigerator, no microwave in the bedroom, even though I personally think that it's not fair. It's their house. If they want to have a small refrigerator in the bedroom, they can. But the city wanted me to do that, and I was like, okay, if the city wants me to do that, I have them do that. Again, I felt bad, but they did that. And I told them that no refrigerator, no microwave. Specifically said, even though it's on the lease, but people don't really tend to read all the lease. So I specifically told them again that no lock on any of their room, on the doors, sorry, because there used to be. But again, I took care all of these issues. Just again, I just want to make sure that I go by whatever the city is telling me to do, not causing problems. Because, I mean, it may not be relevant, but like, I got pushback from my tenants saying that, like, what law tells us we cannot have a small fridge in our room? I was like, there is no law, but I don't have the time and I cannot, like, get a lawyer to go fight with the city, just like, because this small refrigerator may cause potentially this being a rooming house, or like, whatever.
Finish up here, but
Okay. So I just want to reiterate that, like what Michael said, we have to notify the owner to get it. And when an owner rents out their house, even he can't just walk in there. The tenants have to allow him to walk in there. And that's the problem, is that he can't control what their tenants are doing. So they could be using as a bedroom right now. He can't even go walk in there. I can't go walk in there. And that's the problem is, and then I send out a letter to go in, and then they remove it, and then I go in there and there's no bedroom. But I see evidence of a bedroom, and it just so happens that he was removing a mattress and a bed frame and a headboard after I sent out that letter. And I just think that it's a lot easier for him to remove the wall, and even that won't stop it. It's just hard to enforce. They can sleep in the living room.
Yeah.
It's hard to enforce.
Yeah. Is it pertain to just what the appeal?
Yes.
Okay, just please brief.
So just one thing, because I mean, I totally understand this, like, 24 hours or like, whatever notification time. And I guess what they can tell is that, like, as they say, I even need to give them notice to be able to enter. But what I can tell you is, even if they do not let me enter, like, without their permission, what I can do is I can be there in like 48 hours, let's say, not 24, because you want to make sure that, like, I'm able to do that. Like, we can walk up the stairs, okay? And I can make sure that at least, even though they do not let me go in, because, like, whatever they're doing or the kids are alone, whatever, at least I tell them that, like, this time, like, tomorrow, whatever that time I'm going, right? Just keep that curtain open so that we can see inside that room. I can do that without even, like, needing them to let me with the inspector in. That's it.
So
All right.
this letter from the tenant is saying, and I read the Spanish version and the English version, but the tenant is saying, we also want to clarify that we do not live with strangers or people that are not family related. So, because I'm trying to understand if this is a rooming house or not. So
I
just,
have to get that letter just as a proof. And this is like a year and a half.
Yeah.
It's not even related to this case, but
Yeah.
anyway.
No, I thank you, Vivian. I think that's helpful, but I think trying to just stay on the topic of what we are here. And so, yeah, I think for the appeal, I'm just talking to the board right now, there was no bed when they went, but signs of what appears to be a room being used as a bedroom. What the time frame of that was, the headboard or the screws from 2 years ago, or was it recent? Was the nightstand recent? It's I don't think we'll ever actually know without evidence of seeing a bed in there. But I think there's a larger issue that's going on here, and there's concern from neighbors about this particular property having too many people and more than should be staying there, and that's a concern from a public health perspective, obviously. But I think if we're going to stay on the topic of was there a bed there, there wasn't. So, I mean, I can't, from my perspective, I have to, and I'm happy to hear your opinion, but mine is to allow the appeal to go through. Go.
I just want to ask a quick question. When was the last inspection done? The one I have here is in August,
It was August 28th.
so that was the last one. Okay, thank you.
I also have a question. What is the amount of the violation? So is Mr. Said appealing so he doesn't pay the violation, and how much would the violation be? Or
Right-
what's the consequence of him receiving this violation?
There's been no violations issued on this particular notice of violation. Previous fines are over $65,000.
So if he has to pay this violation is $65,000 for the illegal bedroom?
Based on previous orders of this property and previous fines issued to this property, there was $65,000 currently upheld on this property.
So he already paid $65,000. Is the
No, he has not paid it.
Oh, he's not.
But if he's found guilty of this violation, he
The-
may.
the- He appealed every violation that he received
Yeah.
Okay.
to the city's municipal hearings officer. The municipal hearings officer upheld those. Mr. Said appealed the hearing officer's decision to Chelsea District Court. Those were upheld in Chelsea District Court as well.
Gotcha.
So this
Okay.
is a separate matter.
Yeah.
Right, those previous violations are from previous notice of violations.
Okay, okay.
If you keep this order, then he'll have to pull permits within a timely manner to remove the wall. And if he doesn't do that, then he gets fines, but he'll have 6 months to do that.
I don't know if that's really changed anything for me. I mean, there's obviously concerns, but from my perspective, I
I want to be clear as well, you know, when we issue a fine to a property, whether it's a $25 trash fine or a $250 fine for working without a permit, the point of issuing a fine is to change a behavior, not to continuously issue fines week after week, you know, because you just aren't following the trash rules or you're not pulling permits to do work on your property.
understood. Anything you guys wanted to say?
Sorry, I'm still unclear, so I want to make sure that I understand kind of like what we're doing here tonight. So Mr. Said has been charged with a violation because he has been said that he has an extra bedroom, right? If we don't, and so he's coming before the board to appeal this violation, right? If we don't approve the appeal, then he gets charged money, or he has to remove that wall.
Yes.
So if we don't approve it, he has to remove the wall.
All right, he has to pull permits, and we give him 6 months to do
Got
it.
it.
Or he can get fined.
So,
But we-
okay.
like
If we do
Michael
not
said-
appeal, he has to remove the wall. Okay.
Correct. Like Michael said, we don't want to fine people, we just want them to fix their actions.
Thank you for the leeway. I appreciate it. Joanne McKenna. It would be so simple, maybe this problem wouldn't come up again, or issue wouldn't come up again if you just removed the wall. Thank you.
I'm going to ask another quick question. Is there an alternative to not moving, is there another way to solve the issue without removing the wall?
I think it's a fine or remove the wall, from the understanding I have. Is that correct, Michael?
Is that correct?
So, if he removes the wall, he'll have to pull permits within you know, I believe he's already signed a remediation plan, if I'm not mistaken, okay, so he put it on hold. But he would sign a remediation plan would outline the scope of work and the permits needed to do that in a timeframe. Failure to comply with that timeframe would incur more fines.
Okay. Yeah, and I'm definitely willing to hear what you guys have to think, but that's kind of what I'm thinking at this time.
It does sound like this is an ongoing issue. This isn't something that just came up.
Yeah. So, yeah, so the question I have is just to kind of move this along here. So do you want to uphold the appeal or allow the appeal? Or are we going to kind of deny the appeal at this time?
I know we're not supposed to talk about the other issues, but I am gonna have to say something. Mr. Said, quality of life is really important when you have neighbors that are, disrupting your quality of life in your own property. That's very difficult because of noise and some other things that the other neighbors were saying to you. So I know that's not what's before, and I don't know if that's something that the other residents have a way and a means to bring to attention, but I just want to say to the other residents that I'm sorry you're going through that, because it's very difficult to live with neighbors that affect your quality of life. But I think what's before us then is whether we're going to approve Mr. Said's appeal, or whether we're gonna say no and ask him to remove the wall. Yeah. So I'm gonna say I'm gonna say no to the appeal.
Okay.
And the same here.
No to the appeal. Okay, so that's 2-1, so we're going to have to say no to the appeal. I've been overridden, but, so we're going to have to no to the appeal and move forward from there, whatever the processes are, procedures. Okay, we're going to have to stop that discussion for now, move on to the next discussion, which is the discussion of the non-medical marijuana establishments. So, Lauren, I'm going to let you talk.
Thanks, Dr. Bunker. I just want to set some ground rules in terms of the discussion tonight. I have some language that I want to read that was given to me and discussed with the city solicitor and the policy analyst. So I just want to make sure that the board is aware there are currently no special permits in front of the city council for a marijuana establishment. The decisions before the city council over the last few months are related to the following 2 steps. 1, repealing the Title IX ban on recreational marijuana. 2, changing zoning bylaws to regulate construction, establishment, and operation of the following zoning uses: marijuana establishments, laboratories, product manufacturer, retailers, and transporters. With respect to the purview of the Board of Health, the Board of Health is currently listed as a reviewing party of any business application to the City Council for a marijuana special permit. As the proposal is written now, the Board of Health can send written recommendations to the City Council when an application is reviewed. The City Council could not act on the special permit until a report is provided by the Board of Health or 35 days have elapsed since receipt of materials. Appropriate recommendations from the Board of Health could include preventing diversion to minors or limiting advertising. The City Council would not be legally compelled to apply the recommendations of the Board of Health, but assuming the recommendations are reasonable and do not pose an undue burden, there could be an assumption that the City Council would take up those recommendations, but they are not legally compelled to do so. So before any discussion tonight begins, we just need to make clear the discussion by the Board of Health tonight cannot result in any recommendations at this point to the City Council, and nothing can be voted on by any board member that is binding in any way. I just wanted to set that ground rule.
Great. Does anyone want to speak on this matter?
Sure, so thank you so much, Lauren.
Okay.
Thank you so much, Lauren, for that clarification. So I wanted just to be able to discuss this with the other Board of Health members just openly. We haven't had a chance to do this. And I think, you know, what Lauren, the guidance that she's given us right now, I think is also really helpful. So my concern here is that the city council is in the process of repealing the recreational marijuana ban. And as Lauren mentioned, they're also putting in, if this ban should take place, they're also discussing the zoning ordinances, like what would be the distance, how many would be allowed. And so I wanted to talk today as a Board of Health member about my concerns and just have an opportunity to share this with you as my colleagues. My concern here is that we are already inundated with tobacco retailers. We have 48 tobacco retailers in the city of Revere, and we know that this was not by chance. We know that this is intentional because for many years, the tobacco industry targeted community of colors, minority communities to sell their products. We also know that we have a high number of alcohol retailers. We have 23 liquor stores, and we have a total of 84 liquor licenses. And my concern here is that while I really genuinely understand that we need to balance our city budget, I don't deny that. I'm a resident here. I want us to stay in the positive. I feel like my role as the Board of Health is to really consider what is the health impact and the cost when we're looking at different revenue avenues. So I have worked in prevention for 14 years, about 7 of those in substance abuse prevention. And I have done campaigns on substance abuse prevention in the community. I have helped with things like the Revere Beach Memorial. And when we were designing our campaigns, and if we look at our youth health risk behavior survey data, and just by the focus groups that we have done with students, this was what the students would tell us. A lot of students, and we see this from the data, are dealing with anxiety and depression. And so when we would ask them, like, why are you using at that point marijuana specifically, and so they said that they were using it to feel better, so they were like self-medicated. So my concern is that we are kind of grappling with this issue that our young people, their brain is still developing. The brain is like not fully developed until, it's developing throughout our whole lifetime, but it's not like 90% developed until like we're 25. That is why car companies don't rent to people under 25 because they understand their frontal lobe is not developed. So my concern is that when young people start using these substances, they're more likely to develop a very strong addiction later on in life. And the cannabis that we are seeing today is not the cannabis of the 90s. In the 90s, you know, it might have been like 5% THC. And the products available on the market today are much higher than that. Some studies are saying 20 to 30. The New York Times article from October 4th that talks about as legalization grows, so do the harms. Talks about some products as much as 90% THC. So my real concern here as a Board of Health member is that our young people here in Revere have a low perception of harm. They're viewing this as a natural product that can help them, and I'm concerned about aggravating that is going to actually aggravate the anxiety and depression. I'm also concerned about, and again, my stance on this is never a judgment on anybody who's using any substance. We all, for whatever reason, take care of ourselves as best as we could. So this is not a judgment on anybody who uses cannabis, but my stand on this is at what cost are we inviting a $33 billion industry into our city? We are also dealing with the aftermath of what happened with the vaping epidemic among kids. How did we get here? because these companies intentionally use young influencers and flavors to attract young people. And so at the high school, my kids, I have a child at high school right now and somebody who just recently graduated, you will find the little vape cartilages inside the bathroom grates, right? So, and a lot of youth, my kids included, and a lot of the kids of the parents that I use, no, you can't even go into the high school bathroom because it doesn't feel safe. It feels like people are using substances in there. So again, out of all the folks, thinking about this article from New York Times that talk about 18 million people that currently use cannabis, a lot of them without consequences, but there is 1/3 of them that have cannabis use disorder. And this number is even higher for 18 to 24-year-olds with 4 million people who use daily. And it's estimated that in this age group, about 81% of them have the cannabis use disorder. And so, again, because we are supposed to look out for the health of our residents, I understand our counselors need to look out for the budget, and I appreciate that, but we as the Board of Health need to ask the question, what is the real cost? What is the real cost? Like right now, I know we have the opioid abatement funds. I feel like, again, we were deceived. I went to a conference and one of the doctors was talking about how when the pharmaceutical representatives would go to them, they were told them that this drug wouldn't be addictive, and so they were prescribing it, and then we all know what we're dealing with now, and how much money that we had to, sue this company to get this money back. So some of the numbers that we are hearing in terms of revenue are potentially, like I heard Councilor Kelly mention, a 3-year average for Lynn, Chelsea, and Malden was around $250,000 to $300,000. But what are we gonna have to pay as a city when we have to deal with the consequences? So I want to encourage us to put health first, to think about what our retail environment does in our community. And also, somebody was asking, what is the harm? What families have been damaged? And I have to tell you that I have been in this room and I have had a mom come up to me crying and say, I raised my child right. I taught them right, and now my son is struggling with this substance, and we're trying to help him to come back. We're trying to help him to find a job. This is not a unique story. Another person was telling me about a child at Revere High School who passed away from a drug overdose, and this person started with marijuana. And another mom who raised her child right, provided everything that this child needed, and now they're struggling because their child is dealing with a marijuana addiction. I also have heard stories of marriages being destroyed because of this substance. So I know again, I am not trying to promote fear. I am not trying to stigmatize anybody who currently uses, but I'm asking here, what is the real cost to this public health experiment that we are running, and does Revere want to be part of it? So that's what I wanted to make sure that you as Board of Health members were considering today. Drew, another thing that caught my attention, and I wanted to get your perspective as a doctor, and I think it's just a good point to bring up for the community, is the cannabinoid hyperemesis syndrome. So according to the New York Times article, this is something that is being seen more in hospitals. This is a syndrome that is becoming more reoccurring, like it was rare in the 90s, and now we're seeing it more. This happens to people who are using more frequently and higher potency, and what seems to be happening is that they experience this nausea and extreme vomiting, so they're finding themselves in the hospital room, wanting to vomit and nothing comes out. and the only thing that seems to relieve it is heat. And so the article points out that a whole bunch of people may be experiencing this on certain levels. I'm also a very curious person, so I went on YouTube to see from a doctor who's talking about this syndrome and having been a user himself and now recovering. And the comment section is interesting how, people discuss, how this substance gave them relief for such a long time and now they cannot use it. So I think it's interesting that heat also seems to relieve it. So I also just I think this is a good opportunity because as the article points, we in the public health sector may be a little bit behind in having these conversations. I think as the article also points out, the doctors and the coding are just catching up to be able to report on some of these harms that we are seeing. And so I think it's also a good opportunity, again, not to stigmatize anybody, and I especially do not stigmatize young people who have always been the victims of these industries, there's money to be made here, right? And so like tobacco, they have to replace their smokers because they're killing them. And so it's the same thing with industries that come into our communities to make money. So just curious, kind of like Drew and Kathy, what are your thoughts on this? I know we cannot send a recommendation to the city council, and we cannot have these conversations one-on-one because we are a small board, and so that would be against open meeting laws. And again, this is an opportunity to have this discussion as a community about what is the real cost and how. Yeah, what do we as a Board of Health have to say about how much money we then end up spending on these crises? Lauren, I was also curious if you at the top of your head know, for example, how much money we have spent with the opioid abatement crisis. I know that it's not necessarily money that we put in the city budget that came out from the lawsuit. And if you could talk about a little bit about how much are we spending as a city, how much money did we get, how much money do we expect to get to talk about that, to deal with that, the consequences. But I can ask you that later. I just kind of wanted to hear from Drew and Kathy.
Yeah, sorry, just quickly. So I've seen cannabinoid hyperemesis syndrome from excessive marijuana use, and unfortunately, cannabis is something that can be abused, and that is one of the consequences of it. I'm a physician. The way I think about marijuana in particular is, obviously it's legal, so patients are going to use it. I think when it's used daily, it becomes a problem, and I've seen it just from a mental health perspective. So that's my opinion on it, but I'm happy to have someone, it looks like Mark is here to talk, and I'm happy to hear what he has to say, but Kathy, just quickly.
I just want to quickly. I've tried to do a little bit of reading on it about the pros and cons. I know we're talking about the non-medical marijuana. We're not talking about the marijuana. I would also like to know what the policies are at the dispensaries. I know obviously you have to be over 18. 21, thank you. Okay. It was vague as to what I was reading, so you have to be over 21. Unfortunately, it's not going to stop the problem with under 21. They're still going to get it. They're still getting it illegally. So I just, I want to know what the policy is at the dispensary, what kind of information. I do realize that it's a lot stronger now than it has been in previous years. Those were questions I had, so which I can't answer.
Thank you, Board. Thank you, Dr. Bunker. And I'd just like to share some information here.
Can you mind
Yes,
introducing yourself? Sorry,
Mark Silvestri, 501 Revere Beach Parkway. So again, I'd like to share some information here, and this was published October 23rd, 2024. A new published study calls a significant decrease in marijuana use from 2011 to 2021, in a period which a dozen states legalized marijuana for adults. Lower rates of both lifetime and past month-by-month use by high school students nationwide has seen a significant decrease since the legalization. The findings run contrary to the claims from legalization opponents who said that the policy change first enacted in Colorado and Washington State in 2012 would lead to skyrocketing consumption among teens. In 2021, the study says that the month in Periodic Reports Journal, 39.9% of adolescents reported ever trying or have tried marijuana. That was before 2021, so that was 2011 to 21. As of 21, that number has fallen to under 27%. To share, the whom consumed cannabis at least once in the past month, while meanwhile fell from 23.1% in 2011 to under 15% in 2021. Drawing on data from the Centers of Disease Control and Prevention, CDC, Youth Risk Behavior Assessment, which polls 9th through 12th graders, I believe that you just spoke on that, Viviana, polls 9th through 12th graders reported trying cannabis before the age 13 fell dramatically, studies dropping from 8% to under 4% in 21. This significant decrease observed both the ever used and currently using categories, a promising reduction to adolescent use. Despite the long-term declines, a decade saw at least some ups in teen use rates, including slight rise in female teens, dramatic drop in male teens. So, I know you said you did not want to stigmatize, but I have to say, Viviana, you 1,000% stigmatized the use of recreational cannabis. You have put out there false claims, false data, as I have here, data in front of me by RYBS. You said it rises, federal data says it's declined. The concerns that I have and that are being portrayed out there, and whether you're for it or not, facts matter. And when people come before us and say that marijuana is being sold in recreational dispensaries from Venezuela tainted and laced, false. All the cannabis in Massachusetts is highly regulated through the CDC. When you say that it's going to impact our children, you can't be 21. You can go into any liquor store in the state with a child under 21. You can't even get into a parking lot at a dispensary with a child of 21. You can't even pull into the parking lot with a child. So I'm just not sure how a month ago we sat up here as a council, we passed several other liquor licenses, and not one peep was made. No one, not a sound. But then we went to go pass recreational marijuana, and the stigma and the finger pointing and the threats being made are just not fair. It's not fair. And someone that says they're here as a member of the Board of Health should be giving facts and not just their opinion. And that's mine.
Does anyone else have anything else to say?
Mark, if you could come up again, please. Could you share with me the October 23rd, 2024 article that you're sharing? What is the source?
Yes, it is Science in Health. All the data comes from the Journal of Periodic Reports, drawings from the Centers of Disease Control, RYBS is. You have to turn on the mic, no one can hear what the article is. Sorry. So the article is done by Science and Health. They get their data from the findings, periodic reports, drawing from the Centers of Disease Control, RYBS with federal data. I can share you with this after we done, and it has tables, and it shows the dramatic decrease. Actually, the time before recreational cannabis ever passed in 2011, because the first was 2012 in Colorado and Washington, cannabis use between adolescents was up over 40%. 2021, it's down under 26%. So if we're going to share facts, I hope we share facts. Thank you.
Mark, and one more question for you. You mentioned the article talks about youth health risk behavior data. Did you say that's national data?
That is national data.
Have you asked the City of Revere for our youth health risk behavior data to see the trends? I know with COVID, that might have thrown off our numbers because obviously the kids weren't in school, so we may not have gotten the data. So I'm just curious if you have those numbers, or if you, because I know, I believe up to like 2022, the school has made them public, but I don't know moving forward.
Yes, so I haven't been able to get 21 or 22. The last I've seen was 19, and again in the RYBS, all grades across Revere also seen a decline in use. And I have to say to the Board of Health, we heard up here, kids are going into school and they're saying that there's a prevalent use of marijuana, so much so that they're scared to go into the bathrooms. Well, then I asked the Board of Health, what is the prohibition in our city doing to stop this? And if they're getting this means when we don't have the stores, how is opening a store from legal means that takes away the black market going to increase this availability? Because it shows in the neighborhoods that you've legalized, it's decreased because kids have harder access. There's not as many street dealers out there dealing marijuana because they can go right around the corner to get it.
Thank you, Mark. Lauren, do you by any chance, again, I know I'm putting you on the spot, so if you don't have it, you don't have it. How much money are we spending as a city addressing substance use disorders? Like, I'm curious about the opioid abatement funds. I know that's a separate fund that's helping us fund the Suboxone boxes.
Yep.
But how much do we spend as a city with staff? Yeah, like staff and with the programs that we run to support substance abuse prevention or to do like harm reduction?
Okay, I can tell you a quick review of the opioid settlement funding, which I presented to the City Council a couple weeks ago. In terms of opioid settlement funding, as of September 30th, 2024, we have received $674,000 approximately. In fiscal year 24, we spent approximately $97,000. In fiscal year 25, we allocated $150,000. What's left and what's still coming? What's left in our current allotment that we have is around $427,000. And an estimate of what is still coming is around $1.5 million over the next 10-ish years. That is the opioid settlement funding, brief synopsis of, just the numbers. We have a substance use and homelessness initiatives office. It consists of 2 full-time staff. We contract 2 outreach workers who work each about 20 hours a week. We work in conjunction with the behavioral health unit. The SUDI office also, works in conjunction with the public health staff. Does that help answer your question? Okay.
Yes, thank you, Lauren. So we're gonna, it sounds like we're gonna be getting, would you say over like $2 million in opioid abatement funds if it's like 650 $174K plus the 1.5 million that we expect to be coming. So the city of Revere is going to be getting, like in the next 10 years, 2 million to deal with the,
I don't think we know for sure what our total number is gonna be, but we know what we have and we know an estimate of what is still coming. And those two numbers together are over 2 million.
okay, and that covers, does that cover our staff that help address some of these issues?
The fiscal year '24 allotment covered 0.5 FTEs for 2 staff members, but after that, it has not covered staff. It's covering contracts and initiatives.
Okay. And then Lauren, do you know if we have any funds in the city of Revere to pay for prevention efforts? So I feel like a lot of the work that we do with the opioid abatement funds it's important, like harm reduction, the Suboxone boxes. Does the city of Revere allot or have any money set aside for prevention efforts in order to do like campaigns or?
I just want to, just make one point of clarification. Suboxone is a medication for medication-assisted treatment. What we have is Narcan boxes. I
Yes.
just wanted to make
Yeah,
sure.
sorry, I
That's
apologize.
okay.
Yeah.
Okay. Revere is part of a prevention grant along with many other communities. We're in a Mass Call 3 grant with Chelsea, Revere, Winthrop, and Everett, maybe? One of those, something like that. And so every year there's money allotted via that grant to do prevention work. That grant has regular meetings in which the decision on how to spend that money is made. They spend money on things like youth mental health first aid training. They spend money on conferences. They spend money on trainings for teachers, trainings in schools. And the people who sit on the allocation, not necessarily committee, but the people who decide how the money is spent are people like Jill Herwig at the school, principals, public health staff, a wide range of people who help decide how to spend that money.
Okay, thank you, Lauren.
Thank you, Mr. Chairman. Paula Genzio, 245 Reservoir Avenue. I'm the Ward 4 City Councilor. I just want to clear up a misconception. I've been getting several calls on this. The City Council is not repealing the ban on recreational marijuana in Revere. There is no ban. It's perfectly legal in Revere to use marijuana. You can sit in your backyard and 10 feet away, the people in your neighboring yard are smoking marijuana. It's completely legal. What we're doing is looking at dispensaries. Right now, Revere residents are taking their Revere money and in some cases going a few hundred feet outside the Revere city limits and purchasing marijuana. We are surrounded by dispensaries, Chelsea, Malden, Melrose, Boston, Lynn, Salem. So dispensaries are in full operation in these cities, and Revere residents are just going there, purchasing it, bringing it back to Revere, and I don't want to make it seem like this is a money thing, but the other cities and towns surrounding us are benefiting from the money that Revere is spending at them. We, in a very limited, controlled way, are looking to open a dispensary so Revere residents have the convenience of staying in Revere, and the tax revenue and the fees would be collected by Revere. And there is some discussion about revenue, potential revenue, if this does happen, coming in to Revere would go to, a majority of it would go to the building of the high school and into the public health department. So this money that is generated or potentially could be generated would go into the public health department. And we just seem to be mixing the conversation with opioids and marijuana. Marijuana is different. A lot of people use it, a lot of adults. This is an adult decision. So we have tobacco, we have alcohol, we have vaping, we have gambling. And you can become addicted to any of these things, but adults have that choice, and that's what we're looking at and discussing. There is no ban of recreational use of marijuana in Revere. You can use it. So that's what the city council is discussing, and I commend Ms. Catano on the information that she's trying to bring forth. And there's dueling and mixed results when you look at these reports. I don't have it in front of me, but I will bring it to the city council meeting in Colorado. That was one of the first states to legalize it. They see a dramatic reduction in use among teens and children. By taking, as Councilor Silvestri said, taking it off the black market and legalizing it, it becomes harder for kids to get their hands on. So that's what we're endeavoring to do or discussing. We'll find out where this goes Monday night. And I welcome this discussion. I'm glad this came up before the Board of Health tonight. Thank you very much.
Paul, before you leave, can I ask you a question? So, Paul, does the city of Revere currently allow recreational marijuana shops?
No, they do not.
We do not?
No.
So what is the proper language to use? Because I hear what you're saying.
Mm-hmm.
People can use, like, I can go home if I wanted to and go home and smoke marijuana. Any of us
Yes.
here could if we wanted to, right? It's not like it's not like it's prohibited.
Right.
But what is the right language then, would you say, in order to share with the public that right now, the city of Revere does not allow recreational marijuana shops?
Shops, yes. We don't allow shops. Marijuana is legal in Revere. We just don't allow shops. This came after the state voted to legalize marijuana. The city council at the time was very apprehensive about dispensaries and shops. There was a lot of misinformation out there. They thought there'd be traffic jams, people crashing into each other, people walking around in a daze in these parking lots. They thought there was going to be, a lot of craziness happen. So the city council got together and they voted to not allow marijuana shops in Revere. Now, as 5, 6, 7 years have gone by, and we see how other cities and towns are handling their dispensaries, and there really is no problem that I've ever heard of from these dispensaries. In fact, I drive by dispensaries, and I don't even know there are dispensaries. Someone told me there was one night near Home Depot. I go to Home Depot, I don't know, maybe 20 times over the last year. Today I got in my car and I drove around Home Depot and I searched for this place. I finally found it. But I've driven by it 20 times and I never knew it was a dispensary. The one up on Route 1, a couple of 100 feet. I drive by, I think it's closed. There's never a car in it. So the marijuana dispensaries, I don't believe, are the problem. I understand what you're saying about youth getting their hands on it, and it's like any other vice. They can get their hands on alcohol, vaping. Many people get addicted to gambling, and they get their checks, and they spend it all on scratch tickets. So, but like I said, it's an adult decision. And it's been proven that when legalized marijuana comes in, it reduces the impact on teens and young people.
Paul, also, the state law says that we have to go by our alcohol licenses.
Correct.
So we had Paul Capizzi here the other night at the city council meeting, and he mentioned that it has to be 5. So I'm also hearing, and Lauren, I think.
That is correct.
So Lauren, thank you because I know we're trying to clarify what will be our role, and I think it's gonna be like the city council who will do the final approval. And I also have heard some councilors talk about, we won't allow more than 2. But wouldn't we be in contradiction with the state law if, like, let's say we had 2 And then another business came in and said, well, you already zoned it and you have to go by what the state law says. So how can we protect ourselves? Like, let's say we wanted to limit access and availability, just as a city, because I think, you know, residents should have a say about what they want in their environment. But what will protect the city from being able to limit that?
Okay?
Yeah.
So yes, it is based on the number of alcohol licenses. So the city of Revere could have up to 5. But in the zoning committee meeting, I wasn't on the zoning committee, but they greatly reduced where these things can go in the city. So there's another misconception that it's going to come to the end of your street or in your residential neighborhood. There's very few places that these shops can open. So the chances of 5 coming before us are low. But it's a special permit, and they have to come before the council. And like Lauren said, the Board of Health's opinion is sought during that process. So just because we can allow 5 doesn't mean we will. And I don't see the demand for 5 dispensaries in Revere, especially where we're surrounded. It's not like Chelsea people are going to come here. They have their own. So, yes, we could have up to 5. That's state law. If we wanted to reduce that number officially, then it has to go to a ballot question. So I think the city council could certainly come to an agreement. If you're looking to say someone's going to file a lawsuit against it, well, you're allowed 2, and I want to open my 3rd one, and you're not allowing me to, you know, that's a legal matter, but I don't think the city council has any intention of allowing 5 dispensaries in Revere.
But Paul, a few years ago, in 2016, the council was completely different. At that point, again, they supported I'm gonna try to use your language so we're speaking the same thing.
Sure.
The prohibition of retail marijuana shops, right?
Okay.
And then the council changed, and now the mentality is different. So one day I won't be here. One day I might get tired of this. One day you may
Right.
also decide this wasn't your gig. And so
Right.
I guess once councilors move on, but what we put in our law books, wouldn't it be binding? Because it might be another council who says, actually, we think 5 is fantastic.
Well, yes, I mean, that's the way government works. At the time you're speaking about in 2016, it was a huge unknown. The city council didn't know what to expect from these dispensaries. So I think they used good judgment, and they banned them. And now let's see what happens in other cities and towns. Are they going to have problems, or we made a good decision? At this point, we see what's going on in other cities and towns, and they're not having any problems, and none of these horror stories that were first put out there have come true. So I think that's why the present council has looked at that information, and the ideology has changed. Now, it is true, in the future, something else could happen, but that's the way government works.
And do you have an understanding of where these retail marijuana shops are gonna go? Have you been told where? Like, could you point, like?
That's in the zoning that was just agreed to on the 21st.
But could you describe to the public, like, what streets or what
Sure,
areas of the
I
city?
mean, just off the top of my head, the north side of Squire Road where Northgate Shopping Center is, the Suffolk Downs area where Target is. I know those are 2 areas. There's a small stretch along North Shore Road going to Lynn, certainly away from residents' homes. Mark probably can speak more intelligently on this than I did because he crafted that, and I think he's well aware of where they go better than I do. But they're certainly not, I think there was some misinformation. Someone printed a flyer and put it in mailboxes in Ward 6 and took a picture of a dentist's office and said, oh, marijuana coming soon to a neighborhood near you. And the dentist wanted to file suit. The people calling him up saying, what are you closing down? You're putting in the marijuana. So there's misinformation out there, and that was one case of it, this stuffing of a flyer in people's mailboxes. And I know there were residents up here that were irate that night because they thought a dispensary was going at the end of their residential street, and that wasn't true. So at the council meeting, I'm sure we could review these areas where they will be allowed, potentially, if the vote goes through.
What about special permits? So the other night, Councilor Kelly, and I believe this failed, in the zoning subcommittee, she wanted to put in an ordinance so that like a retailer couldn't come, I don't know if it's to us or to you guys, and say, well, these are the rules. I mean, right now, we're talking about 300 feet from schools, playgrounds, parks, where young people congregate. I think, I wasn't sure what the results were in terms of what you guys.
The result was 500.
So 500.
And that's following the state regulation.
And then if somebody wanted to come in and say, actually, I want to do it different, they can, what I saw fail the other day is that there will be an ability to do special permits and so do less
Yes.
distance than that.
So a dispensary has to come before the city council for a special permit. Now, can they ask for a variance that my dispensary that I'm proposing is 475 feet, 450 feet? The city council can look at that and say, well, if it's on Squire Road, there's a 6-lane highway that separates one from the other. So the city council could certainly take that into consideration and say, okay, you're 25 feet short, you're 50 feet short, yes, we can grant you a permit. We would have the ability to do that. Now, are we going to say, someone going to come forward and say, oh, I'm 100 feet from a school, can you waive that? Of course not. I mean, you have to rely on the people you voted in, I guess, I suppose, to watch out for well-being of the city.
Paul, one more.
Sure.
So people in the city often get upset when things happen and they weren't notified, or like, why is this happening, or why is this happening in my neighborhood, or I feel disempowered by the situation that I feel like I have no control over. The amendment to send a notice to residents through certified mail,
Yes?
was it your understanding that that passed?
Yes.
The other night, was it clear how many feet?
I believe it was agreed upon for 500.
Within 500 feet, residents will be.
Would be notified by certified mail, yes,
And
correct.
do you believe that the city council will really listen to residents, or will like the businesses trump what residents have to say? Because
No,
I know
no,
oftentimes,
I-
like when we're looking at money, like, you know, like I think somebody was telling me like there were some hotels going up, and a resident said, this is affecting my quality of life. But do you really think genuinely the council will listen when residents come and say, I really don't want this close to my house? Or will the monetary benefit trump what the resident, that one resident saying?
Well, we're elected by the residents, so first and foremost, we listen to what the residents have to say. And if it's reasonable, we would certainly side with residents. I mean, that's what our job is up here. When you say that people aren't notified that the 500 feet is excessive, but it was agreed upon, and I think those things that the zoning committee put forward are protections for the city and protections for the resident. If a dispensary is proposed and somebody from the other side of the city shows up and says, well, I don't want a dispensary, it's 2 miles from my house, I probably wouldn't consider that as a valid reason. But if somebody is very close, if there's a daycare and what have you, I can't speak for the future, but we certainly, first and foremost, represent the residents.
Okay, thank you, Paul.
All right. You're welcome.
Thank you. Okay, I think we're going to move on here. So next is the licensing. Lauren, do you mind?
Sure, we just have 2 licenses. We have another temporary, 2 temporary licenses that you've heard before. This is for Boston Harley-Davidson and David Martinelli for a body art establishment and an individual practitioner. If you remember, I've brought this before you, in previous months for David Martinelli, who is a tattoo artist who is licensed in Danvers, to have a kind of pop-up one-day licenses that operates out of Boston Harley. So before you today is the body art establishment application for Boston Harley Davidson, which is on 646 Swire Road. We did the inspection on October 10th. The event dates proposed are November 2nd, 16th, 30th, December 7th, 21st, January 11th, 25th, February 8th, 22nd, March 8th, and 22nd, April 5th and 19th, May 3rd and 17th and 31st, June 7th, June 21st, July 5th and July 19th. We have inspected this kind of operation 3 times now. They passed for this inspection, they passed in the previous inspection, so we recommend you approve the license for the body art establishment at Boston Harley Davidson.
Viviana, you approve?
I do.
I approve also.
Okay, great. Yeah, I approve as well. It's 3.
Great, and then the last one is the body art individual practitioner for David Martinelli. Again, he's the tattoo artist who operates at Boston Harley in a pop-up facility. He is fully licensed in Danvers, and his address is 12 Beaconsfield Street in Lawrence. We inspected on December 10th as well. The event dates are the same that I mentioned for the establishment. He passed the inspection, and we recommend that you improve that license as well.
Viviana?
I approve.
Kathleen?
I also approve.
I approve as well. That's 3. Great, that's it from that. And then just close up here, so we'll be canceling the November and December meeting for the Board of Health, and we'll reconvene in January. Thank you.